All right, so we'll go ahead and get started. Welcome you all to the Asthma and Community Health Branch National Asthma Control Program Summer of Sharing Series. This is the first one of our four-part series. Today, I want to go over a few housekeeping items. Please make sure your device is muted during the presentation. We will have a facilitated discussion and Q&A after the presentation, so if you can hold your questions, that would be great. If you have a question that comes up during the presentation, feel free to use the chat feature and put your question there. We'll be sure to address those. Or if there's something that you want to share or say, feel free to do that. NACP hopes that this Summer of Sharing Series webinars will help expand your knowledge of programs, tools, and materials that are readily available to assist you in meeting the requirements of the NOFO EH 19-1902. I know you've seen it in my meeting invite, so each recipient will have to address at least one activity under each of the 6 exhale strategies. So we're here today to tell you a bit about that and how you can achieve that success there. So it's my pleasure to introduce you to the Allergy and Asthma Foundation. Today we have, the Allergy and Asthma Network team. We have the CEO, Lynda Mitchell, Marcella Giamani, and Tonya Nash. So Lynda, I will turn it over to you.
Well, thanks everybody, and welcome everybody, and thank you for having us here today. I'm going to go through the mission of Allergy and Asthma Network and our 4 mission areas, and then I'm going to turn it over to Tonya Nash, who will go through all the exhale resources we have that may be of help to you. So first, our mission is to end the needless death and suffering due to asthma, allergies, and related conditions through outreach, education, advocacy, and research. Those are our 4 mission areas. And health equity is an overall lens in which we plan and deliver our work. You can advance the slide, Tonya. So here's our 4 mission areas. Move on. So first, I'm going to go through our outreach programs, and our main flagship health equity program and our main outreach program is our Trusted Messengers Community Outreach, which are local events in communities. We also have our community asthma and COPD experts, which are healthcare and allied health professionals who go into local communities and provide education and resources to assist people in those communities. We have national media campaigns, and we have awareness days. Next. So Trusted Messengers, this program began back during the pandemic to start going into communities of color and offering events to educate about asthma, screen for COVID, and offer COVID vaccinations. It has since moved away from COVID more and is now doing asthma and allergy education in local communities. And then we form community partnerships where we partner with trusted messengers in communities in order to reach those communities and partner with them on local events and dissemination of educational resources and awareness of our asthma coaching program. And then the third component is that virtual asthma coaching program. This is something we do by smartphone or desktop, and we deliver that program. It's a 6-week curriculum where certified asthma educator coaches will meet one-on-one with each person enrolled and deliver asthma education, asthma self-management education, so that these individuals can learn how to manage their asthma better. We've won some diversity and equity and inclusion awards, and you can see those at the bottom. Next. So I'll tell you a little more about Trusted Messengers. So we've gone into under-resourced populations to initially do, like I said, COVID-19 and asthma screenings. Overall, we've screened 4,000 people. We've issued more than 3,000 masks, gloves, and hand sanitizer over the past few years. We've disseminated a lot of food and flu vaccine vouchers, and we vaccinated 500 people on site. Since the past year or so, we've gotten away from COVID vaccinations, and we now mostly go into communities and we do an asthma screening service during these events that we will go to, and then we will identify people with asthma and invite them to enroll in our virtual asthma coaching program. Next. So we're really pleased with the results. This is a 6-week program. So far, last year we had 276 eligible, 78.6 enrolled, and then most of the people who did enroll, especially after the first year, were non-Hispanic Black populations. We did start a Spanish language asthma coaching curriculum late last year, so we'll be able to report on the numbers for that after 2023. But the bottom line is that this program is very effective in significant improvement in mean healthcare quality of life scores, and that symptom control, disease management, quality of life, use of oral corticosteroids, nighttime symptoms, all those things were statistically significant to improve asthma control in these individuals. So we're really proud of this program and how it has shown effective results in trying to reach the populations that we're trying to serve to really improve their asthma control and self-management. Next slide. So just wanted to just give you some information if you want to explore this. Asthmacoach.org will take you to a page on our website where we have more detailed information about our asthma coaching program, and this is a free program. It's funded mostly through pharma health equity grants, and so we invite you to check it out to see if there are people in your community who would benefit by it. It's free and it's effective, and we want to get the word out and have more partners referring people to this free virtual asthma coaching program. Next. This is just a quote from one of the people who enrolled and finished the program. And the bottom line is that it really is making a difference in people's quality of life and their health. And we're busily trying to create more referrals and ways to identify people so that we can enroll them in this program. We can move to the next one. The other program we have is a community asthma and COPD experts group, and there's about 100 volunteers across 25 or so states. They'll go to events and exhibit and share Allergy and Asthma Network resources. It might be professional conferences, it might be actual community health fairs, and we're really just using these volunteers to effectively reach other people and share Allergy and Asthma Network resources. Next. We also have a public awareness campaign going on this year called Is Your Asthma Under Control? It's multifaceted, it's online, it's offline, it's in print. This article here is a screenshot of one that was distributed in USA Today the end of May, and it reached about 420,000 people. And then the online version also reached a lot of people, but it must have had really information of interest because the average person who went to that page spent 3.25 minutes on it. And for anyone who's aware of online attention, 3.25 minutes is a rather long time. And what we were trying to achieve in this article is a lot of people don't know what asthma control is and what it isn't, and if they have asthma control. And so we were trying to explain that in plain language terms so that if people think that they're using their asthma control because they're using their albuterol inhaler 3 times a week, that's not what asthma control means. And you need to be taking the next steps to talk to your doctor. And if you're not getting to where you need to do to think about seeing an asthma specialist. So that's kind of where we were heading with this article. And we will be continuing to disseminate messages like this for the rest of the year. Next. We also do media. A lot of it is about asthma, environmental allergies. We did 25 media spots after those East Coast wildfire smoke hit us. And, Purvi Parikh is a really very eloquent spokesperson. She's an allergist based at NYU Langone, and she will be able to go onto New York TV shows like like the Today Show, but she also does a lot of online and print as well. We also participate in awareness days like World Asthma Day, and we just get the word out with awareness messages regarding asthma and its detrimental effects on communities and individuals. Next. So our education mission area, we do a lot of multiple monthly webinars. We have new and updated web content. We have a podcast series we started last year with pediatric asthma, and we took a break and then we relaunched it just last month, actually, or was it this month? And I'll tell you more about that in a minute. And then we do ongoing social media with a lot of messages regarding environmental allergies and just maintaining your good asthma control. Next. So here's the next upcoming webinar on August 23rd. It's what to do if a student has an asthma attack. Welcome you to join in. Dave Stukas, pediatric allergist from Nationwide Children's, will be giving that message, and he's a really good speaker, and this is a topic that he's really passionate about. He loves talking to school nurses and allied health people and parents as well. So I invite you to join us for that one. We have 2 or 3 different series of webinars. One of them is our Advances webinar series, and those are developed in partnership with the American College of Allergy, Asthma, and Immunology, and those are CME eligible for medical professionals through the college. Next. And then this is just an example of our drop-down menu on our website with some of the asthma content that we have. I just want to call attention to our asthma action plan page. That one happens to be a compilation of asthma plans that we have found all over the place, including multi-language, ones for smart therapy and others. So I invite you to just check it out and see if it will be of help to you. Next. And this is just something of interest. We have an asthma and allergy forecast. It's an app that is connected with a huge database that actually synthesizes the data and can give people some indications of weather factors that might impact asthma, allergy, or flu prevalence in an area. And so just wanted to point that out. You just type in your zip code and it will give you the forecast for the next 5 days, but also you can actually pick a future date and it will, at least for weather, it will predict with 80% accuracy what the weather conditions will be like. So, for things like planning a wedding or an outside party, this can give you some predictive information about it, not specifically about asthma, but at least about the weather. It's kind of a fun app. Next. And then this is the podcast series I was mentioning to you. We did 3 Kids Breathe Better pediatric asthma podcast last year, and then we took a pause because we wanted to kind of like be more strategic about the webinars, the podcast overall. And so we're launching a new series called Allergy, Asthma, and Immunology Innovations Podcast. The first one that we just launched last week is Asthma and Biologic Medications. And if those are unfamiliar to you or you feel like it's just a very complicated issue, I encourage you to listen to this podcast because Dr. Payal Gupta and Courtney Kwang Hing, who happens to be a patient with a lot of atopic personal experiences, the 2 of them together just do a very effective presentation of complicated topics in a very understandable way. And I learned a lot just from listening to it, and I hope you will too. So I encourage you to listen to it, about a half hour long. And we should be having another asthma one coming up next, and then we'll be shifting gears depending on specific topics of interest that we want to provide to the community. So it'll be about allergies. It could be about other conditions like chronic urticaria. Next. And then these are just example of educational messages that we do through our social media channels. We have 4 or 5. We're on TikTok, as well as we just signed up for the new Meta Twitter platform. I can't remember the name of it right now. But I just want to point out that we really do feel like we got to meet people where they are. And if they're on multiple different platforms, different populations, different groups, then we have to sort of tailor the messages for those platforms. And so these are just examples of messages we put out regarding asthma and environmental allergens. So that's sort of where we're heading with our social media. I do have 2 MPHs that actually handle our social media account. And the reason why we use MPHs is because, especially the lead social media and community and project manager, she's trained in digital health communications and behavioral health. And so she really is very effective at creating good messages with her skill set to implement behavior change through educational outreach on social media. Next. Advocacy. So we have 5 policy priorities. We have 5 current federal and advocacy campaigns, and Allergy and Asthma Day on Capitol Hill is our once a year Hill Day event. And then of course we do coalition work because we're a small organization. So, the power and strength is in numbers and with other groups to elevate all boats. Next. So here are policy priorities. You can see there improve access to medical care and treatment. That's a big one. It affects all disease states and all populations in different ways. Asthma and allergy program funding at the federal level, reducing health risks for asthma and allergy emergencies, like for instance, stock albuterol, stock epinephrine would be in there. Mitigating environmental hazards, that's EPA work primarily. And then improving health equity is another important priority that we focus on. Next. So these are our 5 current advocacy campaigns. You click on them, you can fill out a quick form, send letters to your senators or to representatives, depending on what the bill is that we might be promoting your engagement in. Let me see, protecting children with food allergies is about food allergy, one school, one nurse. We believe that we should have a one school nurse in every school. Safe Step is about access to medication, as is the Copays Act, and then Connect for Health is telehealth. We do advocacy campaigns by email, so we encourage people through our email newsletter or through our social media accounts to go to those campaigns, fill out a form, submit it to their legislators. Next. So this is our last Hill Day event in May, and we had 100 advocates on the Hill. We were able finally to go back up on the Hill in full force, and so that was really a good experience again after the pandemic shut us down and made it all virtual for a few years. And then simultaneously, we did an online campaign through our mailing list, and we were really thrilled that 1,500 of our online participants, advocates, sent 3,500 emails supporting our 4 campaigns that were being promoted at that time. So we really feel like we had a successful Hill Day event in May, and our next one, of course, will be next May. And then research, we've really done a lot of focused work in research over the past 2 or 3 years. We strongly believe that we need to advance the patient voice and engagement for the full community and expand the reach and impact through shared data partnerships, and partner with racial and ethnic minority organizations to disseminate disparity data, and then lead our own research and publish in peer-reviewed journals. During the early days of the pandemic, we got 2 PCORI engagement awards. The first one was Black People Like Me. Of course, for when we submitted to PCORI, it had a very PCORI-like engagement award title to it. But then, of course, PCORI funded work. You need to form a patient advisory group. And one of the first things the patient advisor said is, we got to change the name. And they picked the name, and that's what we used. The title of the series was Black People Like Me. It started in 2020, it went into 2021, and the conference series was designed to help Black community better understand the impact of asthma and COVID-19. We also got into vaccination hesitancy and vaccinations during that time to help educate and inform everybody regarding that. And the whole goal was to just improve health and then to bring people together and to have a conversation. And it was all led by patients. We had a lot of patient testimonials. We had a Black pulmonologist who was the PI for the project, who was a very eloquent leader for each of the sessions. And we recorded everything, so they're online. And then it worked so well that we applied for another PCORI Engagement Award and did one for the Hispanic Latino community. Again, formed a patient advisory group. They picked the name, they picked the speakers, they picked the sessions, they picked the patients who would talk about things. It was really a wonderful experience. And, we started out with bilingual right from the start, where we had 2 channels using Zoom. And then the responses we got were, it's really great, but we wanted to be Spanish first, not got all of us who speak Spanish to go into a Spanish channel. So it was challenging because we had to make sure we had all the speakers who spoke Spanish as their native language. And so, we did manage to do it for session 5, and it was really a great experience. So we're hoping to do more of that in the future. those are all recorded as well. So with this, I'm going to hand over a compilation and review of the Exhale resources that we have on our website and elsewhere to Tonya Nash, who's our project manager for our Exhale program.
Right. Hello, everyone. Like Lynda said, I'm Tonya Nash. I'm the project manager for the Excel program, and I'm going to be sharing some of the resources that we have that can help you meet some of the deliverables that you have for this project. Under the cooperative agreement, we have three goals that the network is seeking to meet. The first goal is to lead a national coalition of partners to discuss current trends in asthma care and advocacy issues, and also to brainstorm strategies to advance the implementation of guidelines-based asthma care throughout the United States. And so we're addressing goal one by our U.S. Asthma Summit. Many of you probably have attended our U.S. Asthma Summit before, which has taken place in various locations all throughout the United States, in person as well as virtually. The summit is a one-day event and it covers many of the Excel-related strategies. We invite dynamic speakers who are subject matter experts on issues related to asthma care. And then after the summit, we survey participants to discover their thoughts about the event and topics that they would like to learn more about. Those results help to guide our work and to help to determine future webinars, future summit themes, and articles for our website. Previous summits are available on our website and also our YouTube channel. And mark your calendars because our next summit will be held on November 10th in Anaheim, California. It will take place in person and virtually. More information will be coming out about the summit in August. Our second goal under the cooperative agreement is to develop and disseminate training, coaching, and technical assistance to promote the implementation of Exhale interventions for healthcare providers, primary care providers, school nurses, and other healthcare professionals caring for people with asthma. We promote the implementation of Exhale strategies to healthcare providers in many ways. One of the ways is through travel scholarships for the U.S. Asthma Summit, and I know some of you have been able to take advantage of that. We also offer educational material for patient education, CHW training, healthcare provider practices, and we also offer monthly webinars like Lynda talked about before. We have a monthly e-newsletter, we have podcasts, and then we also provide support through advocacy through our policy priorities. In addition to those things mentioned before, we also have a Breatherville YouTube channel, which has over 400 videos related to asthma and allergies. Many of the videos are webinars, but we also have educational video clips that feature physicians talking about asthma-related topics, and we also have patients sharing their testimonials. You can view our Breatherville channel at youtube.com/@Breatherville. We also offer asthma education materials for school staff. You can find that on our website, allergyasthmanetwork.org. If you go to the gold navigation bar and click on school, there's a drop down that has many options available for school staff. And the pages of information contains information about signs and symptoms, free downloads, frequently asked questions, evidence-based resources, and more. So we also offer information about our asthma action plans. Lynda mentioned that earlier and shared information on how you can find that. That's also on our gold navigation bar under asthma, asthma management, and the asthma action plan. And we have a variety of asthma action plans there that can meet the needs of most people, low literacy, multiple languages. We also have videos on there and a smart therapy action plan. To further promote Excel strategies, we have created additional resources for schools that includes checklists, we have pocket guides and assessment tools, and these items are very helpful with the Excel strategy of achieving guidelines-based medical management, as well as linkages and coordination of care across settings. While most of our resources are for school nurses or they're tailored towards school nurses, we're also considering the development of resources that are targeted towards other school staff because we know that they should be informed as well. In addition to that, we are currently working out a new program to offer air purifiers to schools at a substantial discount. So be on the lookout for more information about that in the future. We're excited about that. For more specific support for Excel strategies, we created a repository of resources that address each Excel strategy. And these resources come from the Allergy and Asthma Network. They come from state asthma programs and other reputable organizations. We are currently planning to expand this resource hub into a searchable database of Exhale resources. I've contacted many of you over the past couple of months just to ask if you had any links or resources that you would like to share that we could add to this database, and we're still accepting any resources that you would like to share. As it grows, we would like to add, features like filters or, sorting, special keywords where you can sort or search by Excel strategy, and then also, the different types of resources. It's our desire that this resource will serve as a central place where healthcare professionals, asthma coalitions, state asthma programs, and others will be able to find evidence-based resources to use with the populations that they serve. And so here we have screenshots of what the page looks like. When you go to the page, if you click on this section here, there's a drop down that'll take you to each strategy that you can choose which one you want to go to. And then you can also click the letter for the strategy here. And you can find that at allergyasthmanetwork.org/exhale. Here's a screenshot that's kind of blown up of what one of the strategies looks like. This is the first one, education on asthma self-management. And we share this, and we have ways in which the strategy can be used, items on our website and online store that kind of go along with this strategy. And then we also share which audience is most appropriate for this strategy. It also includes a link to the CDC's Excel page on education on asthma self-management to give you more detail and information if that's what you're seeking for. And we have this same format for all of the 6XL strategies. So each strategy looks like this on our page, and there's a list of items and audiences that we are aware of that has resources related to that Exhale strategy. And so we're seeking to upgrade this, and that's our plan for year 4. Our third goal is to develop and disseminate Exhale messages and educational tools in English and Spanish to support CCARE objectives for healthcare providers and families, including African American and Hispanic Latino communities in key areas with high prevalence of asthma across the country. And so one of the ways that we develop and disseminate Exhale messages is through our monthly Exhale emails. I'm sure that many of you may receive these emails from me. And the emails share information on Exhale related topics, webinars, new and updated content from our website. And also, I always try to end with an offer for opportunities for collaboration in each email. We also share information about what's going on with you and in your states. We shared recently about the Florida Virtual Asthma Summit. We've shared about the Big Sky Conference in Montana. And if you have any upcoming events that are open to the public nationally that deal with asthma, feel free to share it with us and we will share it with our audience. We have about 2,300 people on our Excel mailing list, and many people are always looking for great resources. And so feel free to share about any programs that you may have. If you are not on our Excel email list, you are missing out. Just go ahead and scan the QR code on this screen and then fill out the form, and you should be able to join us on that Excel email list. I have a new email that's going out on the first week of August, and it will be focusing on back to school resources. And people who join our Exhale emails they also get free information and promo codes and things like that. So we also have educational tools and resources for the Black and Hispanic populations. Our Trusted Messengers program has coaching available in English and Spanish. And Lynda also mentioned about our Black People Like Me and Unidos Hablemos series. Those virtual conferences are available on our website and on our Breatherville YouTube page. And our online store. So we have an online store with many resources available to help you implement Excel strategies. These materials are available in English and Spanish. We also have a special page that is just for Excel resources. Um, you can view that special page at store.allergyasthmanetwork.org/exhale. Our Exhale email subscribers often receive special promo codes on items throughout the year. I think in March we sent a special promo code out to our Exhale subscribers where you can get 50% off our asthma posters. And so like I mentioned before, we have a variety of publications, posters, and free digital downloads in our online stores. Like I mentioned before, posters are some of the most common items ordered, especially the respiratory treatments poster, which was updated earlier this spring. So if you have a version that's older, we have a new one that's out. The posters help with the Excel strategy of achievement of guidelines-based medical management among people with asthma. We also have content in our publications that help to deal with education on asthma self-management, which is the first Excel strategy. Our Breathe Better at Home is a great resource for home visits for trigger reduction in asthma self-management. And we also plan to update our indoor air repair resource in year 4. So we have lots of resources that you can take advantage of. And most of them are free. So these infographics were created specifically to address Excel strategies. The ones on the outside, left and right, they address the last Excel strategy, which is environmental policies or best practices to reduce asthma triggers. The one in the middle was designed for parents, and it shares how each Excel strategy can help your child to have better asthma control. These 3 items are available for free, and they are available in English and Spanish in our online store. And so you can take advantage of these 3 items in our online store. In addition to the previous infographics, we have several items available in our online store that are available in Spanish that meet a variety of Excel strategies. Almost everything that we have in English is also available in Spanish. And so feel free to take advantage of those resources. Okay. And we are very excited to share that we have a Spanish website that will be launching in September for Hispanic Heritage Month. We want to help reduce the burden of asthma in the Hispanic and Latino community. And so we are expanding our resources to meet that need. And there will be more to come on that soon. Okay. And I see a comment in the chat. Lynda brought up something very important, which is on our poster in around November. It will include Air Supra, which will be available in January 2024. So we'll be updating the poster again. Okay. And that is it. Please feel free to visit our website at allergyasthmanetwork.org to access all of our Excel resources. This is the contact information for me and Marcella. Marcella and I are available if you have any questions or if you're interested in any opportunities for collaboration. This concludes our presentation and we're open for questions. We have several Allergy and Asthma Network staff members on the call, and we all would love to answer any questions that you may have.
Great. Of course. Sorry about that. So if anybody has a question or just a comment, please feel free to raise your hand. And I do see in chat, thank you, Karen, for your comment. And then, and thank you, Shahid, for your comment. And if anybody's having trouble seeing the chat, I can read what's in it.
Would you like me to answer Karen's question that's in the chat?
Yes,
Her
thank
question
you.
is,
Yes.
what curriculum is being used and what asthma support software do you use, or at least what supports are offered through the software? So I am not the expert on the actual curriculum, but I can tell you that it's a curriculum that was developed that's consistent with all of the asthma guidelines. It's going to be a workbook involved in it. We updated that just a few months ago, and we're moving to a new asthma coaching program platform in September. The reason why we are moving to a new asthma coaching program in September is because through our analysis of the data and talking to patients who completed the program or dropped out of the program, we found that the current platform that was being used required the latest and greatest smartphones. And when trying to reach the populations that we're trying to reach, they often don't have the latest and greatest smartphones. So we realized that that was a platform wasn't going to really work for reaching the people that we really want to reach the most. So we looked and we selected a new platform. And so anybody who wants to participate on it will be able to do so regardless of the version of smartphone that they might have. And yes, the asthma coach they're all AECs. And one is a respiratory therapist in AEC, and the other is a physician's assistant with a 15 or 20-year history working in asthma and allergy physician offices. And so she's well versed in that. And then she's also an asthma educator, certified asthma educator. And the people who take the coaching love her, and she's really wonderful. And that's, I think, she has led to the great outcomes that we can show through the data that I shared with you. Another thing that we're doing just to see if there's any other is the trusted messengers is something we're trying to build partnerships with. And so, as I mentioned, we're trying to see who those trusted messengers are so that we can reach more people. So we're sponsoring the National Medical Association's Asthma Summit at the end of the month, so we can bring the Trusted Messengers Project to those in attendance at the Asthma Summit. They're all going to be physicians of color, and they're going to be going back into their communities, and we're hoping that they will share the asthma coaching program with their patients who need it. And then we are going to be going to Ebenezer Baptist Church in Atlanta at the end of this month for their back to school event. We've done that in prior years, and we're going to be doing that again. And then we just confirmed that we will be at Harlem Days in New York City. We're going to be with the Black Health Matters special health summit that they're going to be having on the 17th of August. And then we will be there on July 19th in the city of Harlem, sharing asthma education resources. And the way that we screen people is with a survey instrument. It's about 10 questions. And those who then are screened for asthma, then we will invite them into the asthma coaching platform. And because of the atopic nature of all these conditions, we've added additional questions to screen for eczema and food allergy, because we know in the future that we might be able to bring some additional, perhaps coaching or additional resources that we can share with people who are screening as suspecting of or confirmed having food allergies or eczema.
Okay, great. I'm not seeing any other questions. We will share the slides with you all, and so that you will just be able to click on the links to make it a bit easier. And anybody that has a question, feel free to go ahead and ask that. Comments are welcome, or any discussion topics that you would like to bring up. And Lynda, did you see that last question there from Marie?
Yeah, yeah, Marie Christine. I believe I would have to connect you with our chief research officer so that she can talk to you about that. I know once people are enrolled in the asthma coaching program, there's additional surveys that we use to actually help people and do pre-post test things like that to help us gauge how they're working their way through the program and being successful at it. But one of the tools we use through that is AirQ.
I know that a lot of information has been shared, so I'm sure you all are soaking it in. Lots of appreciation. I learn something new every time I hear from you all. So I love this opportunity. Okay, and any of my CDC team that you have any questions that you would like to ask? Or any comments? All right, it's been a very quiet group today. Yes. Well, thank you so much. I appreciate you all and the work that you're doing. Our jurisdictions, I know, benefit from you all and your assistance that you provide. And, CDC thanks you for that. If you succeed, we all succeed. So thank you for your time today. And we'll share the slides in the near future. And if anybody has any questions, feel free to reach out to Tonya, Marcella, or Lynda, or myself, and we'll be happy to help. Just a few things before Lynda, do you have any closing comments that you wanted to share before I close it out?
No, I just want to thank you for having us here today, and I'll put my email address in chat in case anybody wants to reach me directly.
Great. All right. So, folks, just want to remind you that this was the first in our summer sharing series. So, on this Thursday, the 27th at 2 p.m., we'll hear from the American Lung Association. Then on August the 1st, we'll hear from the National Environmental Education Foundation. And then the Asthma and Allergy Foundation of America will present on August the 22nd at 2 p.m. So please tune in for those. And we appreciate your time and take care and have a great rest of your summer. Thank you.